on to other matters. The health workers' strike entered its fourth day today with no sign of an agreement in sight between the government and the medical workers. Wilson Buru with the latest public health paralysis.
It has been an endless nightmare for patients in public hospitals as the effects of the health workers' strike continues to bite. Reports indicate that at least 5 people have died as the strike entered its fourth day Friday. But not even this will deter the workers from continuing with the tug of war with the government over who is responsible for running of the health sector. The Kenya Medical Practitioners, Pharmacists and Dentists Union says the government has refused to negotiate with the workers to come up with a solution.
We expect to have unnecessary deaths, and I believe probably even there are more happening in the home. And these are the issues we are talking about. This is a very shameful and unfortunate situation which the government should bring under control immediately by engaging the members so that we identify the problem that is at hand, we solve it, and we go back.
A court order sought by the Health Cabinet Secretary James Macharia and issued by Justice David Majanja earlier this week to stop the strike did not solve the problem. The union says it has not received any communication from the courts over the same, adding that it might be a ploy by the government to twist them into going back to work. The collapsed talks between the Medics Union and the Council of Governors was caused by the provisions of the Constitution on what the doctors are asking for. Questions now linger on how long the strike will take.
The issue has been that the health function was devolved to the counties without there being a law in place as required by the Constitution, as required by the law. There must be legislation which is going to guide the implementation of that devolution process. But it was not done that way.
As this unfolds, patients continue languishing in various hospitals as the workers stayed away for yet another day. Most of them want the government and the workers to come to an agreement for their benefit.
Kuna mpaka services kuna yote tumefanyiwa. Sasa ilibidi tutafute dawa za dressings tujitengeneze tu.
Mguu imedugo hapa. Imepita hapa mpaka pande nyingine. Kafugwa hivi nikaangiwa hapa. Sasa hii kidoda inakaa tukipaguza. Hatukuwa na dawa na nini? Ndio jana tukatumana madawa. Sasa sisi wenyewe ndio tunajipaguza.
The situation was, however, different at the Longisa Level 4 Hospital in Bomet County, where interns took care of outpatients. The health workers are protesting plans to have their salaries paid by county governments. Matenda Chere says there is no law that transfers this obligation to the counties. Whether the counties or the central government pays the salaries of health workers is not a problem for the thousands of patients who have not had medical attention for the last 4 days. What is important is for the two sides to sit down and come up with an amicable solution. Wilson Buru, KTN Friday Briefing.